Good.
Maybe I did.
Hey, what's going on, everybody? This is Dr. Schilling from Sequoia Health bringing this week's Wednesday Wellness Minutes, and we have our lovely Amelia here with us, who just so happens today is pretty poignant because she has a headache and has been working on computers all day, working diligently to get our word out there to the masses, which we appreciate your support in doing so, because without you, people wouldn't learn as much about us as you've been providing us to them. So let's talk about headaches. Headaches are a big problem for a lot of people. Headaches are not normal, contrary to most people's conception or misconception rather. Headaches are not normal. They're oftentimes caused by stress, postural things, toxins, things like that. So for example, in Amelia, she has been spending quite a bit of time on a computer today, so if you just swivel that way a little bit, and I'll help you with your hair. Tendency, what happens is people start jutting forward like this because they want to look at the computer, they want to get close to it. You can come back up to normal. There you go. And what happens is it gets extremely tight at the base of the skull here. These are called your suboccipital muscles. This bone back here at the back of the head is called the occiput. These muscles here are probably the culprits for 95+% of the headaches in this world. And they're the symptom, unless of course it's a postural issue where you're sitting down like this and you're constantly working on the computer all day long. They are also susceptible to frustration, anger, resentment, and disappointment, which happens to come from the gallbladder. If you have any of those issues, it's helpful to resolve them. Gallbladder, if you're unfamiliar with it, is on this side of the body. Your liver is this area here, a big triangle, and the gallbladder is connected to it off the common bile duct. We don't need to get into anatomy like that. But what happens is when there's not enough energy coming up through the body, these muscles get weak or over tight or both. And what they do is then they can constrict what is called the greater occipital nerve, and you can have pain at the base of the skull, on the side of the head, in the forehead, in the eye, pretty much anywhere on the side of the head or anywhere on the head in general. So when we talk about, and I already mentioned the neurological or the mental emotional stresses, which is anger, frustration, resentment, disappointments, but you can also look at the jaw. The jaw here is affecting your C1 vertebrae, which sits right about here under the ear, behind the jaw, and at the base of the neck and skull. That's a big problem for people, and that's really about inability to chew on situations or circumstances, inability to bite back on certain things that are frustrating, things of that nature. So there's a ton of different stuff. You can use a bunch of different things to help with headaches. First and foremost, you can do like a myofascial work, where you can work at the base of the skull. So I would do certain things to her as far as helping her. Would you mind taming your mane?
Sure.
Thank you. All right, there you go. So you can work, if you slide your hand up the neck to the base of the skull, you'll kind of hit the ridge here, the occiput. So you want to work underneath that ridge, basically from this bone here behind your ear called the mastoid all the way back to the middle on each side. That's going to be good for myofascial release. You can work on the jaw muscles to release the tension there, because that can throw off the C1 vertebrae, which can cause constriction of the blood vessels in the vertebral artery and everything else that goes up into the skull. You can work on things like PEMF and pulsing the liver and gallbladder area. But just to give you an idea, I'm going to show you what's called strain counter-strain. And this is really helpful to understand how you can either teach your practitioner on how to test if you have an issue with your suboccipital muscles, or you can test your partner, your friend, your family member, something like that. So what I'll have you do is hold your head back like this, and I want you to push back toward me. So that's super strong. Okay, relax. Now push back again. Okay? And what happens is, as soon as she activates it, it goes weak. Okay? So that shows me that these muscles are excessively tight, which she could have told you already. But it's easier to show. And how much pressure do you think I was pushing on the first time?
A lot.
A lot. And how?
20
Right.
I don't know.
Oh, 50. Easily 50.
Okay.
And on the second time, how hard were you trying to resist?
Very, very
Yeah,
hard.
and it was impossible for her to resist because I was applying a little bit of pressure, but her nervous system couldn't keep up with the stress. So that's a quick screen for understanding whether the suboccipital muscles are tight. The gallbladder meridian comes right up the neck and then fans across here like the ram's horn. If you ever seen a ram, like look at the St. Louis Rams helmet, that's pretty much what the gallbladder meridian looks like on the side of the head. Okay. Now, understanding physiology, the gallbladder receives all its contents from the liver. So usually what happens is, if you're not pissed off about something, frustrated, angry, resentful, or disappointed, it's because your liver is dumping garbage into your gallbladder. Okay, so think of your like a funnel, which is your liver, and the tube coming out the bottom, and off that tube is a little sac called your gallbladder. So everything that goes into the gallbladder comes out of your liver. So if your liver's toxic, if you drink too much, or other chemicals exposed to and it can't get out. You can have a starvation complex from your liver where you're not getting what you need, you're missing out on things, you're not getting what you want, in other words. Or it could be a territorial conflict, like spouses could be locking horns. It can be that you're having territorial conflict at work or with a coworker or with a friendship or something like that. But these are kind of things that can affect you. And so we want to understand that the headache is a symptom, right? Unless you've fallen down and smacked your head on concrete or been in a car accident, there's really no reason why you should have a headache. So something is not getting enough energy or blood flow or oxygen, which are all of the above, going into your brain, which is what's going to cause a headache. And when you're like this young lady who's been spending her entire day, between two computer screens up and down, there's a lot of tension on the neck, okay? So we know what happens there. We can do different therapies. This time we would actually do a resistance exercise to lengthen the muscle, and then we might even have to go back and strengthen it if it were necessary. If you turn this way, what we can do, can you hand me those pedals? Sure. Okay, so PEMF-wise, you can do several different things, right? You can put them over the liver and gallbladder, so right here is where the liver and gallbladder are, and we oftentimes pulse our participants in this position. You can also go back of the head. That's also very good for putting energy into the area that's not getting as much. You can pretty much pulse anything. You can lay on the bed and do it. You can lay on the chair, on the stool. It just depends on what you need to do. But PEMF energy is really good for healing and cleansing. It activates all the tissues. It opens up the blood vessels, because if you know anything about migraines, typically they're vascular, or meaning blood vessel. So when the blood vessels constrict because of stress, not enough blood and oxygen, things get to the brain. Okay? So for her, it's mostly postural. For other people, it could be neurological or mental emotional stress. And it can also be metabolic, where the toxins can't get out. But these are just some ideas of what can be related to headaches, right? Always remember that headaches are not normal. Doesn't matter what the circumstances are, unless you've had blunt trauma to your head. Okay, then you are entitled to have a headache. But other than that, this is not a case where you would expect. And people they have days of headaches. They're incapacitated. They can't go to work. They have to go in dark rooms and can't handle light and stuff like that. They have aura, all the kind of fun stuff. People are throwing up. Okay, good times. Mm-hmm. So we use things like liver support, like Liver ND, OptiCleanse, OptiClear, things like that to get toxins out. Coffee enemas are probably the coffee colonics, we'll call them, more gentler. People don't like the word enema for some reason. Coffee colonic, okay. Dr. Iverstone is famous for saying the best part of waking up is Folgers in your butt. That's one of the funniest lines I've ever heard in my life. It's hilarious. But if you ever need to get rid of a migraine, that is a fantastic way, because it's like taking a trap door and opening it up on your liver and get that out. Okay, so you can use that. You can use myofascial stuff, myofascial, depending on how you pronounce it, tomato. PEMF is fantastic. Understanding where your conflicts are and how they're not being resolved and getting those taken care of, whether it's territorial, whether it's a starvation complex, whether you're angry, frustrated, resentful, or disappointed. It just depends on what's going on. Okay, but just understand, if something's going on in your body, there's a reason behind the symptom. And if you can pinpoint that, you can then be empowered to understand what it is, where it's coming from, how to get rid of it, and how to never have it again. And if you need somebody to teach you, that's what my job is. Doctor means teacher, so your doctor should teach you what to do, help yourself. And then our team here, like Anissa and Amelia and Melissa and Christine, and soon to be who knows, are here to guide you as well, to provide you the support and the necessary tools, and that's what we're here for. Okay, so any questions about headaches, any questions about your particular case and how it affects you and how you can overcome yours and never have them again, because that's what we specialize in here. Not just headaches, but every other condition. We support people with conditions. We don't treat issues or symptoms. We treat people, and that's what we're here for. Okay. So if you're interested in becoming an active participant, let us know. One of these ladies will be happy to help you figure that out and give you the information you need. Otherwise, send us a message on make a comment below, I guess you could say. Let us know how headaches affect you, what you find helpful for you, because remember, other people are watching this and they can benefit from what you know and how you handle these things, not just what we've explained here. And that would be helpful. And share this with your friends and family. Do them a favor and let them know what they can do as far as understanding what's going on the inside, what's going on the outside, how they can find out what it is, and how they can fix it as well. Okay, and if you need help fixing it, just let me know and I'll be happy to do that. All right? So thanks for joining us today. We appreciate it. Share it with friends and family, and we'll look forward to seeing you next week for the Wednesday Wellness Minutes. Bye-bye.